Hi guys, good morning to all. Welcome to our channel Nursing Update. Hope you guys are doing well. Okay, let's start our today's topic. Okay, so before starting our today's topic, if you are new to our channel, please subscribe and press the bell icon to get the daily updates. As a part of psychiatry, today we'll see the second part of psychiatric questions. Okay, let's move on to today's topic. So the first question is, which one of the following is not an indication for ECT? What is ECT? Hope you guys know. Electroconvulsive therapy. Okay. So the options are option A, major depression, option B, severe psychosis, option C, severe catatonia, and option D, post-traumatic stress disorder. Okay. It's one of the easiest question I have ever seen. Okay. The answer will be post-traumatic stress disorder. Okay, so I was explaining in my first slide, in first video, how to attend an MCQ. Okay, so in this take this MCQ as an example. The other three options like major depression, severe psychosis, severe catatonia. Okay, this is a negative question, means which one of the following is not an indication, means they ask which is not an indication for ECT. So these three are the indication for ECT. Major depression, severe psychosis and severe catatonia are indication for ECT, and post-traumatic is not an indication for ECT. Okay. So coming to the next question, drug of choice for catatonia. What is catatonia? Catatonia is one of the type of schizophrenia. Okay, what is schizophrenia? Schizophrenia we'll discuss in our later videos also. Okay, the schizophrenia, there are many types of schizophrenia is there. Okay, among that catatonic schizophrenia is one of the major classification. Okay, so what is the drug that is used in schizophrenia? Option A, benzodiazepam, option B, haloperidol, option C, carbamazepine, and option D, sodium valproate. Okay, so the answer is benzodiazepams. Okay, so I have given two treatment options for catatonia. I hope you remember the first question in my video. Yes, severe catatonia is indication for ECT. Okay, and the first line of drug of choice for catatonia is benzodiazepam. Okay, catatonia is one of the type of schizophrenia. In schizophrenia, many types are there: simple schizophrenia, epiphrenic schizophrenia. Okay, like that. Among these types, one type is catatonic schizophrenia. Catatonic schizophrenia means the patient will be rigid. Okay, stupor. What is stupor? They won't communicate with others. Okay, they won't aware about the environment about there. Okay, if time permits, we'll discuss catatonia, catatonic schizophrenic alone in a session. Okay, so remember this: catatonic schizophrenia, drug of choice is benzodiazepam, and in severe cases they use electroconvulsive therapy. Okay, coming to the third MCQ, delusion of grandiosity is seen in. Okay, so I have already explained in my previous video. If you didn't watch what is delusion, I have shared the description shared the link in the description, okay, of my first video on psychiatry. Okay, what is delusion? I have explained what is delusion, what are the types of delusion in that videos. Okay, so what is delusion of grandiosity? Delusion means false belief, fixed false belief. What is grandiosity? Grandiosity means, suppose I am having a thought. Okay, this was my first MCQ which I discussed. I hope you people remember. Delusion is a disorder of thought. Okay, suppose if I am having a thought that I am a Prime Minister of India, or I am a Chief Minister of a specific place. Okay, or I am the US President. Okay, this kind of thoughts if I am having, that is known as delusion of grandiosity. Okay, or else I can make rain. Okay, I can make the C2 become into desert. Like that, if I am having a thought, that is known as delusion of grandiosity. It is seen in depression or schizophrenia or mania or alcohol withdrawal symptom. So the answer will be obvious. You people know schizophrenia. Okay, in depression you won't see. Yes, in mania you won't see. In alcohol withdrawal syndrome also you won't see. The correct answer is schizophrenia. Okay, coming to the next MCQ, which one of the following is not an antipsychotic medication? Okay, before going to this question, let me explain a very important point in psychiatry. You take any of the question paper all over exam, means all over India, any of the government exams question paper, okay, in nursing for a post of nursing officer, you will get minimum 3 or 5 questions in psychiatry. In that, one question will be sure, 100% surely will come from treatment modalities in psychiatry. Okay, either they will ask from drug point of view like antipsychotic, antidepressants, okay, anti-manic, okay, or what is ECT, or they may ask therapeutic like Millu therapy, okay, social therapy, okay, cathariasis, like that many other therapies are there, like that they may ask. Okay, so this is one of the most important part in psychiatry, treatment modalities. If you can't able to read the entire psychiatry, at least read treatment modalities related questions in psychiatry. You will surely get one question, pakka, 100% pakka, one question will come from this part. Okay, so coming to the question, which one of the following is not an antipsychotic medication? Options are haloperidol, risperidone, olanzapine and imipramine. Okay, so antipsychotics, where antipsychotics is used? Yes, it's used in schizophrenia. Okay, broadly it is classified into two categories. Yes, typical and atypical. Okay, so this haloperidol, risperidone, olanzapine, they comes under, olanzapine comes under atypical, haloperidol comes under typical. Okay, the risperidone also comes under this atypical. The answer is imipramine. Okay, so this is also negative question. They have asked not an antipsychotics. Okay, which one is the not an antipsychotics? The answer will be imipramine. Okay, so other three are antipsychotics. Okay, coming to the next question. The client has been on long-term phenothiazine 400 mg per day. Patient had jerky choreiform movements, lip smacking, neck and back tonic contractions. This indicates that the patient developed option A Parkinsonism, option B tardive dyskinesia, option C dystonia, option D akathisia. I have already explained treatment modality is one of the major part. In that major part, two big shots are there. Two people are ruling these treatment modalities a lot, that is antipsychotics and ECT. Okay, in antipsychotics, most of the MCQs will come on adverse effect of antipsychotics. Okay, so the below listed are the adverse effect of antipsychotics: tardive dyskinesia, Parkinsonism, dystonia, and akathisia. Okay, so here the key word is long-term used. Okay, means the person is on treatment for a month or for a year. Okay, first of all, phenothiazine is an antipsychotic. Okay, so the patient is on long-term use of antipsychotics. Okay, he or she is developing choreiform movements. Okay, lip smacking, neck and back tonic contractions. This indicates the patient developed tardive dyskinesia. Okay, so if the patient is on long term, okay, of antipsychotic treatment, they develop tardive dyskinesia. Okay, the one of the most important word in this question is long term use. Okay, so to cut the long story short, long-term adverse effect of antipsychotic is targetive dyskinesia. Okay, so coming to the next MCQ, after taking haloperidol, patient develops upward lateral movement of eyes. The term used to denote is, what is haloperidol? I already explained, it's one of the antipsychotics. Okay, either same options here also, Parkinsonism. Okay, in this question, the options are same Parkinsonism, targeted dyskinesia, dystonia, akathisia. Okay, so here the patient is developing upward lateral movements of the eyes. Upward lateral means the person eyes are going in the upper direction means, and in lateral direction also. So the answer is dystonia, and to be more specific, the term used here is oculogyric crisis. Okay, what is oculogyric crisis? The question is the answer. Okay, here the patients develop upward lateral movement of eyes. Okay, so as a brief explanation, I have given the extrapyramidal symptoms in a shorter form. Okay, what is extrapyramidal symptoms? The adverse effect of antipsychotics. If a patient is on antipsychotics, they develop so and so adverse effects. This under this so and so disease conditions comes under one umbrella that is known as extrapyramidal syndrome, that is EPS. Okay, the patient may develop acute dystonia. Okay, so onset will be after taking immediately. Okay, hours to 5 days. Okay, so here what happens? Spasm of tongue, neck, face and back. Okay, we have seen a question, right? The patient is having upward lateral movement of the eyes. Okay, it's in the face. Okay, so that is dystonia. Then Parkinsonism. Parkinsonism, I hope you people know. Okay, the onset will be 5 days to 30 days. Okay, so tremor, shuffling gait, drooling, okay, stupor. Okay, these are the symptoms of Parkinsonism. Then akathisia. What is akathisia? They have repetitive motions. Okay, they will do whatever the physical activities will be repetitive, motions will be there, and agitation will be there. Okay, it will be for 5 to 60 days. And tardive dyskinesia, it takes months to year. This also MCQ we have seen. Long term adverse effect of antipsychotics is tardive dyskinesia, lip smacking, warm like tongue movement, fly catching. Okay, these are the features which is seen in tardive dyskinesia. Okay, the main MCQs is the onset. Okay, immediate adverse effect of antipsychotics is acute dystonia. Okay, late adverse effect of antipsychotic is tardive dyskinesia. Okay, Parkinsonism and akathisia is normal side effects, and you should also know the features seen in these side effects. Okay, one more adverse effect I didn't mention, that is neuroleptic malignant syndrome. What is neuroleptic malignant syndrome? Let me know in comment box. Okay, so that will motivate me to do further videos also. That's we have ended our today's session. Hope you guys like our videos. Please share your valuable comments. If you like our videos, share to your friends also. Okay, so thank you for today's session. Okay, I will be coming with another set of MCQs in tomorrow's session. Okay, so once again, subscribe our channel if you didn't subscribe, and like our videos and share to your friends. Okay, thank you so much.